Welcome to the new sound of online radio. Welcome to the sound of Universal Broadcasting Network.
'Cause you make me feel like I've been locked out of heaven.
A mix of today's hits and hard-to-find favorites, combined with the most entertaining and intriguing talk anywhere. This is your sound. This is the sound of Universal Broadcasting Network at UBNradio.com.
You're listening to the Dr. Dee Show about neuropsychology and well-being. Get the knowledge you must have to live a powerful, positive life. The Dr. Dee Show. Here for you.
Welcome, listeners, to the Dr. Dee Show. Today, it is wonderful to have you with us. Always good news. We are growing, and our listener group is growing on iHeart Radio, Stitcher, iTunes, and, of course, on Facebook now. We will be, as usual as today, posting the actual live link to our listeners, so you can tune in with us. The usual disclaimers: this show is psychoeducational in essence. It's not meant to replace professional mental health advice or therapy. So if you do believe you suffer from a particular disorder, please do reach out to professional help. With that in mind, some of the topics that we cover on this show are not appropriate for the younger population. Hence, your discretion is advised. The topic of today is targeted to answer just very, very basic question that always comes in the door for when neuropsychologists and neurologists when a patient comes through our door and is concerned as to whether he or she are declining cognitively. And the more we are aware of the difficulties of being diagnosed with a cognitive disorder, particularly a progressive disorder such as Alzheimer's, Parkinson's, and other types of dementia-related disorders, we understand that if we feel there is a change in our cognitive functioning, we are likely to be very concerned. Of course, just because we might suspect that we have those changes does not mean that we indeed have a cognitive or memory disorder. It is important to know that there are various kinds of psychological factors that could feed into your overall cognitive functioning and then may result in a functioning that's less than optimal or a functional change. And so it is very important to go to a trained professional, a trained neuropsychologist that is going to do a comprehensive battery of tests and look both at the cognitive component, but also be excellent at the diagnostic process of the psychological condition you're at, and be able to differentiate what is it that we're seeing. Are we seeing a psychological issue, a cognitive issue, or perhaps the existence of both? So that process, that diagnostic process of discerning what is it that we're seeing is crucial in terms of being able to arrive to the true picture of what the person is suffering from, and also based on that be able to classify where is the person, if they do have a cognitive disorder, which type of cognitive disorder are we suspecting is present, what is the level of impairment, which areas in the brain or which areas in the functioning of the person that associate with particular regions of the brain do we see the impairment. And finally, based on that, we are able to make recommendations for treatment. So one has to understand it is a complicated process. It is not something that is done with an hour of appointment at the doctor's office. It is something that is done with a few hours, typically at a minimum 4 hours, mostly about 6 hours, and sometimes 8 hours worth of testing. And in the more complicated cases, you might have 2 days worth of testing for the individual. These are the cases that are outside of the typical regular medical setting, but or have many complexities, such as the existence of personality disorders, the existence of multiple impacts to the brain, and then, of course, when there are legal questions, those types of testings become more robust. But going back to the topic and the concept of cognitive decline, so as you can deduct from what I'm saying, it is a complicated process, and it's going to look at various domains in the brain. So you can ask yourself, well, what are the signs that I need to pay attention to as a person that might clue me to the fact that I might need to go see a professional? Okay, so today we'll talk about some of the signs that most of you may know, but then we're going to talk about signs that many individuals don't know about, and some of the signs that we know more recently are being linked to cognitive decline as early signs, okay, that could really clue us in that direction. Now, just common sense suggests that cognitive decline can occur in various areas of the brain, okay, which means various types of functions of your brain can be impacted as a result. And various types of those functions may show early signs of deterioration. And so what we will be doing now for the next 40 minutes of the show, we're going to go over the main signs that we see clinically early on when the deterioration occurs that might clue us to the fact that the person may be suffering from an early memory or other cognitive impairment that can lead to a particular progressive condition and a degenerative disorder. Now, why is it important to detect it early on in the game? You know, you'd ask yourself, well, if I'm going to be having Alzheimer's, or if I'm starting with Alzheimer's, what's the point for me to figure out early on in the game that, you know, that I have it? You know, it is what it is. There is no curing pill at this time. It's only going to go downhill from here. So, of course, the most negative approach to the situation, and understandably, because it's difficult. Life throws difficult situations towards us, and one of them is when individuals get diagnosed with a cognitive impairment. So one might ask themselves, well, what's the point of knowing, you know, or detecting early? So knowing whether we have a diagnosis or not is one thing, which I'm not going to be addressing right now. But detecting early, which is the subject of today, is what we're going to be talking about. Why is it important to detect your condition early? For very many reasons. And that is as simple as possible. One of the main reasons is because there are treatments out there, although those treatments at this point that are readily available, I'm not talking about experiments that are going on now, actually worldwide, both in the United States and Israel mainly, that look very promising now in terms of being able to potentially reverse some of the effect of Alzheimer's and other memory disorders. But even when we just look at treatment that is available for the public, we need to understand that discovering the condition early is allowing us to give pharmacological treatment that research shows and studies show delay the progression of the condition. And secondly, there are types of imaging, brain imaging techniques, for example, such as FDG PET scan, which allow us to confirm the diagnosis of the person early on. If the scan is done in the first 1 to 2 years of the disease, research suggests that diagnosis as to whether it is Alzheimer's that we're seeing or a different type of memory disorder, we're able to make that decision in a more accurate way. And based on that, pharmacological treatment, there are certain kind of medications that do help in slowing down the progression of the disease, but those medications are not helpful for certain types of memory disorders and in fact could be harmful, because medications do interact with other medications that we're taking and can actually result in harm rather than doing any good. So knowing early on in the game that we do see early signs of cognitive decline or memory disorder, and being able to then confirm that diagnosis and detect it accurately does make and can make a big difference in terms of the treatment that's going to be given to the individual at a critical point in time, and then take the person hopefully on a different cognitive course than it would have been without treatment. And we do need to understand that although those conditions are progressive, it does not mean that we cannot make improvements in the life of the person, that we cannot slow down the progression of the disease, that we cannot do any treatment at all. There are treatments, and the what we call prognosis or the progression of the disease can look different with proper treatment. So it is important to recognize early signs of cognitive decline. The second reason that I would like to mention why it is important to recognize the signs of cognitive decline early on is that, and this is something sometimes people are not aware of or don't think about as a reason, but when our loved one starts declining, so many times these signs will show up as small increments, and they will be identified with a particular type of function of the person, such as, for example, personality, okay? And we might not detect that what we're seeing is an actual cognitive decline. What we might think is that the person is out to get us, or there is a deterioration in our relationship. For example, if this is your spouse, okay, and suddenly your spouse is changing, they become louder, they yell, they become inappropriate, they're rude, they say hurtful things. Well, the first conclusion naturally that we would have is, something's going on with my marriage. Why is my spouse being so nasty to me? And I've seen that before, where clients would come in and the level of irritation that they would have with that comes along with the personality changes of their loved one is severe. Now, what it's causing more conflict. It's causing alienation between you and your spouse. And what we're having is actually an unfortunate situation where instead of knowing that our spouse is suffering from a cognitive decline, from a serious situation, and that we should help our spouse and give them the proper treatment and understand that this is not personally targeted against us, which is all the things we would be doing, we're likely to be doing when we know that this is a cognitive impairment issue. We don't have all of those coping mechanisms because we think this is purposely done against us and towards us. And we think that it's a marital conflict rather than a medical problem that we're dealing with. Same, it doesn't have to be with a spouse. Same with any family member. It could be a child, okay? It could be that, my parent is hitting their 70s or 80s, and suddenly they're more stubborn, more difficult, or rude, or tell me mean things. And my level of frustration as their child, because I'm always going to be, let's say, my mother's child, my frustration with my mother might be over the top feeling, why is she saying these horrible things to me? Why is she being mean to me? And so forth and so forth. And looking at it from an interpersonal perspective, where really this might actually be because of a medical condition. So just based on what I was saying now, you can deduct that one of the 10 signs that I'm going to discuss today are changes in personality. It's not something that we think about right away, but one of the early signs that the person might be cognitively declining is that their personality changes. And when we say personality changes, it could go different directions, right? If they were, let's say, real introverts, more to themselves, maybe more polite and reserved, and then suddenly they become louder. They show more mood fluctuations. They become rude or inappropriate. For example, inappropriate jokes. There's one case that I know of where the person was a very respected former judge. And he always really paid attention to what he said and how he said it, and was very respected by his colleagues and his peers and his family. And here he was giving a speech at a friend's event and began sharing very inappropriate sexual jokes right there on the podium. And individuals in the crowd were uncomfortable, and his wife was so ashamed and distressed. And lo and behold, the judge was tested, and he did indeed suffer from cognitive decline and an onset of Alzheimer's disease, and he just had less control, less ability to control and be aware of what he was saying. And although Alzheimer's, the hallmark is a decline in memory, other areas of the brain begin to deteriorate as well. One of them is the executive region of the brain, which is the front part of our brain, which, as I've described many times before, is the CEO of your brain. And it's also the area that's in charge of controlling emotions, inhibiting responses. We might think about sharing a sexual joke, but we won't actually say it. And the deterioration in the ability to control and mitigate that process is one of the signs that maybe the person is beginning to cognitively decline. So notice about your loved one, and if they are in an older age, or they have been exposed to harmful toxins or substance abuse, and they're somewhere there where they can have an early onset in their 50s or 60s. Often, of course, we will see it more in the 70s, and research suggests that about 1 out of 4 individuals, about 25% of individuals in their 80s start hitting will be diagnosed with a memory impairment. So when you start seeing that your loved one is changing in front of you, and it's odd, it is not the way they normally are, it could be something, it could be a reason or a concern enough to get them checked and see if indeed this is related to a cognitive problem. Remember that if they used to be extroverts and then suddenly they are pulling back, they're quieter. One of the most common complaints that I will hear or observations is that the person just used to be the life of the party, okay? Be very popular, tell a lot of jokes or stories, and then suddenly that person is withdrawing back. They're not as social, not as talkative, not as responsive, don't initiate conversation. That's something we look at as well. That might give us a clue that the person may be cognitively declining. The second one that I want to talk about is one of the most common ones that that most of us notice, and that is the number one reason often that why individuals would come to their doctor, their neurologist, or to their neuropsychologist to be tested, and you can guess that memory decline. So when the person starts feeling that they just don't remember things as well as they used to, they start forgetting more where they put things. They start forgetting what were they supposed to be doing. For example, they will walk into a room. They knew what they were going to do in that room, but then by the time they get to the room, they don't remember what was it about that they were going to that room for and what were they were going to do. So that's one of those types of memory lapses they would have. Their spouse would tell them, I already told you that. I already told you that. Why are you asking me again? So asking again the same question because not remembering that this was told to them before. Not remembering appointments. Not remembering stories or information that individuals give them. Maybe remembering but not being able, and that's a little bit of a different cognitive task, not being able to produce the information, or retrieve the information from our mind forward to be able to express that information or repeat that information. All of those types of memory problems individuals report when they start having concerns about their memory. So that's a second and pretty obvious sign for us to pay attention to. Another one that is tricky because it is in general one of the top mental health issues, or one of the most common mental health issues that we see in general in our society and with increased numbers, that is depression. Okay, so when the person suddenly becomes depressed, now here's what's tricky. It could go either way. Okay, with certain types of cognitive declines, the person will be very depressed at the beginning and not quite know why. That does link to the neurochemistry of that particular person or what they're suffering from. For example, Parkinson's disease will have the component of depression because there are abnormalities with dopamine. And on the other hand, sometimes when the disease progresses, we would actually see more apathy. Okay, the person just doesn't really care. It seems like they don't really care about various things. They don't really care about what they're going to be doing, or the fact that they do suffer from a cognitive problem, or what their loved ones think about it. They just seem like they're in apathy about their situation. And sometimes the apathy shows up later on in the disease. And in some ways, I sometimes think it might be a blessing, because I would not want them to be depressed forever, and also maybe emotionally react so strongly to the fact that they are deteriorating. So perhaps sometimes I think that the apathy is in some way more of a blessing. But it is really a cognitive thing, and it's really something that they're going through. And so that either depression or apathy are early signs, or can be early signs, of a cognitive decline. Another area to notice, and that extends to both verbally and non-verbally, meaning the way we communicate with our words, or the way we actually function about our environment in a non-verbal way, the way that we communicate with our body or with our actions. Okay, so that's the verbal and non-verbal. One area that we're seeing that could be a sign for cognitive decline is repetition and perseveration. Okay, when the person starts repeating themselves over and over again, okay, they repeat themselves when they speak because they simply don't remember that they said it already before, or they repeat their questions again because they don't remember. but also might repeat actions over and over again. And what we really call perseveration is tending to be, the simplest way to say it is to be stuck in something. When you say this person is stuck in this thing that they do, when the person just perseverates, it just doesn't let go, whether it doesn't let go of an idea and it goes over and over again, or it doesn't let go of an action. They keep repeating the same action over and over again. Maybe a person that normally likes the house clean and neat, they would normally clean in the house in the morning for a certain period of time, but then let go. But then you start seeing that they're cleaning the same area over and over again, and they have not had an obsessive compulsive disorder to begin with. They didn't do this their whole life, but then they suddenly start doing it over and over again, and they repeat the action, and they spend a lot of time doing the same exact thing they did before. Or they tend to continue with the task. Those continue with the same thing, continue with the same even cognitive image. For example, we would give them a cognitive task, and then they would repeat that cognitive task again at another time, even when they were not requested to do so. Maybe they were requested to do something else, but they're going to they hang on to the same exact thing that they were doing before, and their mind just hangs on to it and then produces it again and again. That is something that we also call perseveration. Okay. It seems to be that the mind is conditioned for that. The mind seems to like to hold on to something over and over again. It's a soothing thing for our brain, and it's a soothing thing for us to do the same thing over and over again. In fact, understanding that psychologically also helps understanding OCD. OCD is an anxiety-based disorder. The rituals that we repeat over and over again are designed to soothe our anxiety. They're designed to lower the level of anxiety that we have by repeating the same thing over and over again. Okay? So it's designed as a reduction mechanism for the anxiety that we're experiencing. So, as I said, I like to call it a soothing mechanism in the brain. And so that's one way to look at repetition and perseveration. Now, we covered 4 so far. Let's touch on another one. Number 5, okay? Social withdrawal. Social withdrawal is very important because I feel so many times this is one of the signs that families don't think is a big deal at the beginning. They don't think it's important. And when even the person themselves, they don't think it's that important. You see grandma, and grandma is hitting about 70, and she just wants to stay home more, and she prefers watching her television more and do some activities at home, and she doesn't really want to go out so much anymore. And she used to belong to, let's say, art clubs or music clubs or any activity clubs, and suddenly she doesn't go to those clubs anymore. She doesn't want to do as many activities as she used to do. So many times we might look at it and say, well, she's getting older. She's just tired. And she'll say things. Many times older people will say, I'm tired. I don't want to do this anymore. I'm tired of that. And many times it's not a sign of cognitive decline. Many times they are tired and they're older and just don't want to do all the stuff they used to do when they were younger. But sometimes, particularly when it's in general, okay, a social withdrawal, not just reduction of stress or reduction of obligations, okay, because that's a thing that is good for people to do when they reach a certain age, is to reduce their level of stress. It's to reduce the amount of responsibilities that come their way. But we're not saying that. What we're saying is that the person is just socially disconnecting more from their social system. Things that used to be pleasurable and nice for them, meeting with their friends, etc. And you start seeing that the person is not doing that anymore. They sort of like retreat, okay, into themselves. social isolation is one of the signs that the person might be cognitively declining. Now, number 6. Yay, we're halfway through. Number 6. Number 6 are sensory changes. That's something that's, relatively speaking, less covered in typical regular clinical settings. I don't think it's a question that all clinicians ask, but I always like to ask because there's a lot of research behind it. One of the hallmarks is olfactory changes. So one of the signs that somebody is declining cognitively and might actually have Alzheimer's, an early onset of Alzheimer's, for example, is the inability to smell things. Okay, just losing that, we call it olfactory, but it's really your sense of smell, your ability to smell things and detect smells, or being bothered by certain smells that used to never bother you, but then they suddenly start bothering you. That could happen also after experiencing stroke, by the way, or mini strokes, TIAs. So it's important to understand that that could be a sign, and that it could be not. Okay, it could be many other things, and it's really for everything we say today. It could be other things. It could be other reasons. It could be other diagnoses. But if that shows up along as well with the other signs that I'm mentioning, that could be also a sign of cognitive decline. So in general, not just the sense of smell, but other senses might start declining. The sense of touch, the sense of hearing or seeing may or may not be associated with cognitive decline. The sense of smell, olfactory, is particularly has been linked in research. So that is something to pay attention to. I don't want to go too much into it, but one of the reasons is because the olfactory system in your brain is quite unique and touches on certain regions that may be associated with areas that we could later on associate with decline that we see with Alzheimer's disease. Another sign, we're going to go to number 7 now, are motor difficulties. That's another pretty common reason why individuals would come into a neuropsychological evaluation, and that is when they start feeling changes in the way that they move. Now, motor changes could be all kinds of changes. Okay, a person can have changes in the way that they speak. So that's the motor system that's responsible for speaking. But one of the more common ones is shakiness of the hands, difficulty with fine motor activities, difficulty with writing. In fact, one of the early signs of Parkinson's is starting to write very, very small, writing their name very small, writing things very, very small. So those changes, we call it graphia or micrographia in that case. But fine motor changes, things take longer to do with your hands. Also, balance and coordination is a very big one. Difficulty with keeping yourself balanced, with being able to coordinate movements. That relates to all sorts of functions that we test when we do neuropsychological examination. So that those types of motor changes, slowness, balance and coordination, being able to process things at appropriate speed, we call it processing speed, but just feeling like you're doing things slower, okay? That could be one of the early signs that maybe there is a cognitive problem going on. And one of the other signs that I want to talk about relate to a combination of factors that relate to what we call executive functions. The frontal part of your brain, the prefrontal cortex, that's responsible for processing complicated information, complex activities, and also responsible for inhibiting responses. Like I said, inhibiting things you would say or feel or do, and also planning and organizing information. So that whole chunk of functions relates to what we call executive functions to the front part of your brain. Those difficulties can start showing up, and the person starts having difficulty concentrating, following through with tasks, planning and organizing what they need to do, follow up on multiple tasks successfully, doing complicated tasks. Person might say, I used to do these types of problems so easily, I used to solve them so easily, and now it's really difficult for me. That would be something that they would have a hard time with, but also something that we test for, that I like to look at as well, which is lack of mental flexibility. The person is not as flexible and more being able to change from one task to another, being able to change strategy based on changes that come their way. So that's an area we definitely would look for to see if there's any decline or difficulty in comparison with how the person used to be. So that was number 9. Now, number 10, okay, and I'm going to repeat all of those at the end of the show. So if you missed any, I know some of you told me that you're writing notes when I speak during the show. So if do not worry, I will be repeating those points again at the end of the show and summarize for you the information. The 10th sign of cognitive decline are experiencing psychotic-like features where the person was not psychotic throughout their life. They were not diagnosed with a psychotic disorder, and yet they start experiencing things like delusions, hallucinations, types of odd ideations, etc. So suddenly, sometimes also, by the way, paranoia. So suddenly they'll suspect you of taking things in their house. I had multiple cases where the person was older, hitting dementia, and they start suspecting their children or the maid for stealing things, stealing anything around the house, or blaming them for things that are going on. And it's very hurtful. I mean, when you're the child of someone that starts deteriorating this way, and your parents start blaming you for taking things or doing things that you feel are very silly or, don't make any sense, it could be very hurtful and very frustrating. And so, but sometimes it is because the person is cognitively declining and there's something going on. So I urge you to think about that paranoia, signs of, when paranoia starts showing up, different ideas and, ideations that are just odd thoughts and odd beliefs that never used to be there before, and they suddenly show up. Seeing things or hearing things that are not there. Okay, that's also a sign. In fact, Parkinson's, certain percent of patients experience that. And so it's important to know that those type of psychotic-like symptoms can also be early signs of a cognitive decline. Something that so now we summarize those 10, and I'm going to go over those one more time at the end. Again, what I want to really touch on is how we deal with it, how we deal emotionally and psychologically when our loved one is deteriorating. And I want you to think about it, that one of the best ways to deal with it is understanding, first of all, that there is a separate medical problem that is causing your loved one to deteriorate, that they're not doing that purposely to you, that they are suffering, okay? They're suffering. And that, they themselves are trying to handle what is happening to them, what is going on with them. And that often the impairment, all of those different signs that I mentioned and more, the impairment is cumbersome to them and difficult for them to handle things around and communicate with you. And so they need a lot of assistance, okay? A lot of assistance, a lot of patience, a lot of good professionals around to support them and to support you and to support the rest of the family, because there are going to be all sorts of days coming your way and all sorts of moments that you're going to come up with questions or moments that are difficult, and you're going to need that support system to be there to help you. And so, you know, knowing that creating an environment that of individuals working together to help their loved one and receiving self-care, not just for the patient but also for the family members, is crucial in terms of, you know, successfully managing the situation and allowing for your loved one to age with dignity. Okay, dignity is a big word in the aging reality. Okay, with dignity, with care, with love, with safety. Okay, something that's an issue also for the elderly. And make those years, however many years that they have left, make those ones occur in the most healthiest way and managed way possible. And so what I definitely would encourage you to do is really truly process that, come to terms with that, and know also that you yourself, as a caretaker and as a loved one, will go through stages, all sorts of stages, such as anger, frustration, fear, dread, and in a way mourning a loss of a part of your loved one of that is deteriorating. But I also urge you to know that focusing, and that's a recommendation that I wholeheartedly give my patients and their families, is focus on the love. Focus on the love, first of all, because even when a person is in advanced stages of Alzheimer's and other memory disorders, even if they might not be able to pronounce your name anymore, or we're talking about more advanced stages, they could still many times feel more fundamentally whether they are safe, whether they are cared for, whether they are loved, whether they are experiencing an environment that makes them feel secure and protected and cared for. So it's very important to focus on that. And rather than looking at how much the person was cognitively declining, or testing their cognitive abilities, or confronting them about, which is really what you should not be doing, about what they don't remember or they can't do, is focus rather on the things that they can do, and do things like art. Okay, because art is very expressive. There's wonderful, amazing things happen when patients with Alzheimer's and other cognitive impairments do art, where they don't have to speak and they suddenly express themselves through pictures and images and things that they put together. They could tell you the most incredible messages. You know, I had one Alzheimer's patient that was a very intelligent doctor, retired, who now had Alzheimer's, and he was painting. We were painting together, and he painted a very black picture. And he had still very intelligent speech. He had ability to use very sophisticated words. It's something that was preserved from his many years of being educated. And he was painting a very, very black picture. And his motor ability was already quite impaired. So, you know, the picture was not as sophisticated as maybe he would have. But something more incredible happened, which is, you know, I asked him, why did you choose black? And he said, the black represents my fear. My fear because I know that I have a disease. And then he drew colorful circles around it. And I asked him what those were. And he said, you and my family and all the people around me. And he wasn't able to say names of people. He wasn't able to remember his doctor's names or some of the family members, but he was able to tell that there were people around him who love him, who encompass his, who can hold on and encompass his pain and hold his hand through the process. And that was such an incredible, amazing moment to see how much depth he could express through painting. Those were not things that he was expressing or saying prior to the painting. And so one thing that I would encourage is focus on creative activities and activities that allow the person to feel good, open, relieved, achieve freedom through those types of experiences. So that's something to think about. Now, just going back to reviewing the 10 points, I'm going to go ahead and mention them again. So, number 1, changes in personality. Person used to be an extrovert, for example. Now they're more of an introvert. They used to be an introvert. They become more extroverted. Inappropriate comments, changes high and low in terms of mood, etc. 2, memory problems, forgetting things supposed to be doing or where or what to say, on what was happening, what was told them. 3, depression or apathy. 4, repetition and perseveration. 5, social withdrawal. 6, sensory changes, olfactory changes, sense of smell, but also other senses. Motor difficulties, slowness, balance and coordination, processing speed issues. And now we're going to talk about processing speed issues is number 8. Number 9, lack of mental flexibility and difficulty with planning and organizing information, following through with complicated tasks, following through with multiple steps of a plan. And 10, psychotic features, delusions, hallucinations, and odd ideations. All of those ones can be in combination or in more isolated way, early signs of cognitive decline. With that in mind, I hope that all of us will not experience those types of problems, but if we do, or our loved ones do, that we're going to fight through it, that we're going to have the strength and the resilience to ask for the help that we need, have the right support system to help us follow through with that care that we need, and manage it well. With that in mind, I want to let you know that we would love for you to support the show by liking it on Facebook and Twitter and Stitcher and iHeartRadio now. We're very blessed at our beautiful growth, and we really hope that you can communicate with us. For any questions, concerns, topics that you want to cover, topics that you would like to have an expert on the show, this show is for you. So go ahead and email me at contact@drdeegaines.com, contact@DRDEEGAINES.com, or communicate, of course, through the Facebook page, the Dr. Dee Show on Facebook. There's only one. You should find me. And let us know your thoughts for anything that you want covered or discussed. We are going to have an exciting interview next week, and some very, very cool topics coming up in the next few weeks. So do check us out on Facebook. With that in mind, I also want to wish every single one of you health, happiness, well-being, success, positive interaction, positive life, and all types of beauty in your life and in your present state. And be well.
You're listening to the Dr. Dee Show about neuropsychology and well-being. Get the knowledge you must have to live a powerful, positive life. The Dr. Dee Show. Here for you.